Okay, we're down to the last, which is Adriana Rauseo, and she is going to talk on striving in medical mycology, challenges and opportunities.
Okay, good afternoon. So I'll be the last talk in this session about career progression. First of all, I want to thank the organizing committee for the invitation and for allowing young investigators as myself to talk about our career paths. I have no disclosures. So I wanted to talk a little bit about my background to understand some of the challenges that I faced in my career. So typically the linear path of medical school, residency, and fellowship require much less introspection than compared to the point when you reach the end of your training and you have to contemplate multiple career paths ahead of you. In my case, as an international medical graduate, or IMG, my career path, that linear path was not as straightforward. I faced multiple challenges coming to train here to the US. And the first one was requiring a visa for postgraduate training. And this comes with a subsequent need to complete a visa waiver, which is difficult in itself to acquire in an academic center. There's limited positions per state. And also this requires for you to do 3 years of clinical work exclusively in order to practice in the US. Despite these challenges, I knew I wanted to train here, so I came and did my residency at UT Houston. And here I was introduced to the world of mycology when I was working with Dr. Luis Ostrowski. And then I decided to move on to fellowship at Washington University, my current institution, where, as any fellow, I was mastering clinical skills, and I was required to talk about what my career path would be and seek mentorship to navigate career path and provide opportunities. I was lucky enough to find great mentorship and an amazing opportunity, including invitations to write review articles that jump-started my career in mycology. So after finishing my first year of fellowship, highly front-loaded in clinical work, I successfully managed to publish my first publication in mycology in novel antifungal treatments in development in open forum infectious diseases. This article was included in the highly cited collection of the journal, and this paper played an unexpected but very influential role in my career as it placed me in the radar of medical mycology. So, given my growth and interest in clinical research and mycology, after finishing my fellowship, I decided to do an additional year focused on that. So I started to gain expertise in managing and treating patients with invasive fungal infections. I built research skills that have provided me tools to be more productive in this area. During this time, my career path took a turn when the COVID-19 pandemic emerged. And as many of us had to contribute in different ways, my role was to contribute as a sub-investigator in our clinical research unit, and I was involved in multiple translational studies and clinical trials in COVID-19, including NIH studies that were, we were the top enrolling institution worldwide. And this exposure has led me to be interested in clinical trials, and now I'm starting to lead some of these novel antifungal trials in our research unit. And subsequently, after finishing my fellowship, I am now joined the faculty in WashU in the ID division, and I'm completing that visa waiver. So my research interests are multiple, including endemic mycoses, invasive candidiasis, invasive fungal infection in immunocompromised hosts and transplant recipients, and clinical trials studying antifungals in development. My research has mainly focused in histoplasmosis and candidemia, as we see a high rate of these infections in our center. Our group has managed to create large databases for these infections, and using these databases, we have successfully conducted several studies in analyzing epidemiology, and these are some of the publications that we have published in clinical outcomes and antifungal treatments for these infections. We have also developed clinical predictive models in patients with candidemia to improve clinical outcomes in these patients. So I mainly work as a clinical faculty, but I've performed highly in different areas. So I was recently promoted as assistant professor. I have a leadership position as co-director of the invasive mycosis clinic, where we provide specialized care dedicated to patients with invasive fungal infections, immunocompromised hosts, transplant ID. And I also continue to work in research as an investigator in the clinical research unit. And I have also been appointed as part of the editorial advisory board for OFID after continuing my work with them after my publication. So one of the questions I was asked to answer is what excites me about research in mycology. So I think there are different aspects, and some of them I have listed here. I think that mycology is a field that's very underappreciated, and we have a shortage of clinical mycologists, and we need to increase awareness of the burden of invasive fungal infections. Small observational and clinical studies can be innovative and have great impact to change practice in the field. There are multiple opportunities to discover new treatment options for patients with difficult to treat and pan-resistant invasive fungal infections. I feel there's a very collaborative nature, and I've been able to see that during this meeting. It's easy to connect with others to contribute to the growth of the field. And there are still a lot of niches with unfilled knowledge gaps that encourage further research. Although my career is still in the early stages, I have faced some challenges and I have some concerns for the future. As an IMG and my visa status, I am committed to do mainly clinical work with very limited participation in other areas like research, education, and administration. I'm ineligible to pursue some major training grants like Gray Awards, and I have restrictions for additional degrees like Masters in Clinical Investigation. Although I've been lucky to have some training in clinical mycology, overall there is a lack of formal training in the field that promotes some variable clinical practices, and I think we need to identify better opportunities to expand outreach to fellows and trainees in early stages to promote pursuit and career in medical mycology. And some of these points we've already addressed in sessions from yesterday. Funding continues to be an issue, so there's for support for investigator-initiated studies and trials for antifungals in development. I also think it's important to focus some of the funding related to studies that analyze outcomes in patients that have survived invasive fungal infections to improve their quality of life. And the role of young investigators, I feel there needs to be better support, participation in committees and protocol development teams, also increase opportunities for networking and foster collaboration among institutions and industry, and establish pathways for mentorship. I think that's it. Thank you.